everyone showing solidarity. I'd also like to thank everyone who is showing solidarity with their Asia Pacific patient partners by joining day 3, either late in your evening or in the early morning. Today was originally going to be hosted by one of the steering committee, Shyam, but he's had a conflict arise. So I've stepped in at the last minute and hope to do Shyam justice. Shyam should, however, be with us for the last session today. To introduce myself, I'm founder of a social enterprise called Access CR, which provides services to the research sector around clinical trials and patient engagement in research. What drives this work is the desire to give voice to patients in research and to acknowledge the work that they do and support research participants and patient partners to get their needs addressed, which is why I love the PxP conference. I'd like to take a moment for a land acknowledgement. I'm hosting today from my home office on the ancestral unceded lands of the Wallumattagal clan of the Eora Nation in Sydney, Australia. I'd like to pay my respects to their elders past and present, who have cared for the lands and waters of this country for tens of thousands of years, acknowledge their role as our first scientists, and also extend my respect to the Indigenous people and their elders from the many lands across the globe that you are joining us from today. PxP is an international virtual conference, and some of our attendees may not be familiar with this land acknowledgement practice. So we do encourage you to spend some time to learn about it and reflect upon what land acknowledgement means, and take your time to share your own land acknowledgement in the chat if you'd like to do so. A word about words. We realise in some places different words are used. Patient, patient partner, patient research partner, consumer, patient and public member, patient engagement, consumer involvement, patient and public involvement. But we know we're all here globally to talk about how people with different types of lived and living experience are working with researchers as partners in research. A few housekeeping notes for today. We'll have 3 sessions here about advancing best practice in research partnerships. We will have a 30-minute break in between sessions, except for the last session, where we'll have just a 15-minute break. The first session is on publishing as and with patient partners. The second session will highlight other types of often non-academic patient partnerships. And the third session is on learning about different types of recognition for patient partners. And we'll wrap up with a You Can't Ask That, a session where you can ask whatever you'd like about being a patient partner in research, where I and another well-known consumer advocate will be in the firing line. Using the Q&A function of Zoom, please use that to ask your questions of the session speakers. We'll try and get as many questions answered as possible. Please use the chat function to share about yourself, share any resources you'd like people to know about. We will be capturing the thoughts and resources shared in the Zoom chat in anonymised summaries for each session. Closed captioning is available to viewers who join the session through Zoom. Turn this on by selecting the CC button at the bottom of your screen as a viewer. You can then select the language you'd like these captions to appear in. We won't be spending too much time today introducing speakers. We'll ask you to look at the conference website to read more, and there'll be a link in the chat for that information. We'd like to acknowledge Mary Bocage, who had agreed to be part of this year's steering committee and who passed on earlier this year. We'd also like to acknowledge all patient partners who move in and out of the patient engagement and research space, whether they're still with us or not. Our social media hashtag is hashtag PxP24. Please feel free to share anything you wish on social media. And please know that we are recording all sessions and they will be posted on the PxP website after the conference, so people can watch who weren't able to join. While the conference has been designed for and by partners, of course, we welcome all others who have joined us. It is important we are all learning together. We also want to let you know that we took your feedback from the PxP 23 conference into consideration. The committee have done their best to diversify the steering committee members and all of our conference speakers, as well as take into account some of the topics you said you wanted to learn more about. We'll do the same with the feedback you provide this year, for this conference and community are all about you. I'd like to thank the conference support, which is from the Canadian Institute of Health Research's Institute of Muscular Health and Arthritis. And so now I would like to welcome Clare Ardern as moderator of session 1, to take the lead now for the first session, which is about publishing as and with patient partners. Thanks, Clare.
Thanks, Janelle. And thanks to everyone who's joining us today. Welcome back if you've joined PxP before, either in the last couple of days or if you've joined previous PxP. And welcome to anyone who's joining us as a new participant. It's wonderful to have everyone here. And as Janelle mentioned, we're focusing specifically on publishing in the next 55 minutes or so. My name's Clare Ardern. I'm a researcher in musculoskeletal health. So I work with patient partners. We do community-based research to try to understand more about how to live well with pain in muscles, bones, joints, etc. We do a lot of work in digital health, and I think the other hat I wear is as an editor-in-chief of a journal, and I have about 10 years of senior leadership in academic publishing that I bring to this table. So I think that's the most relevant hat for today. I will also acknowledge that I'm joining you from the traditional, ancestral and stolen lands of the Musqueam people in the area of Canada, what's now known as Canada in Vancouver. And I'm very grateful to live, work and learn on land that has been stewarded by people who have deep knowledge of how to take care of health for time immemorial. Now, onto today. As you can see, we have three wonderful speakers joining us today. I'm going to quickly zip around the Zoom room and ask each of them to do a very brief introduction to set the scene for today's session, and then we'll get into our discussion. So I'm going to start with you, Nidhi. Please introduce yourself to everyone who's joining us today.
Thanks, Claire. Very good morning, afternoon, or evening to everyone attending this session. Thank you so much for being here. My name is Nidhi Swarup. I'm the founder and president of the Crohn's and Colitis Society of Singapore. And this was registered within a year of my diagnosis of Crohn's disease. So in collaboration with others, I have published in a few journals over the last 7 years. And I'm also the founding chair of the Alliance of Patients Organizations Singapore, or APOS for short. It has a multi-stakeholder board of directors as we believe in patients co-creating healthcare. Thank you.
Fantastic. Thanks, Nidhi. Sophie, you're up next.
Great. Thank you so much, Claire. It's so wonderful to be here. I've really been enjoying this conference so much. I'm Sophie Walker. I am a patient editor at the British Medical Journal, which I'll be calling the BMJ, excuse me. I'm one of the number of patient editors who are responsible for leading the patient and public partnership strategy. And I'll be telling you more about that as we go along with this session. I've had type 1 diabetes since I was 6. I had a stroke when I was 10. I have long COVID. I've recently taken on caregiving roles for family members. I've never done a land acknowledgement before, but I'm going to do my best. I'm probably going to mess it up, but I figure it's better to try than not to do it at all. So I'm based in the US and in Cambridge, Massachusetts. And I pay respect to the people of the Massachusetts tribe. And I come to you from the ancestral land of the Massachusetts tribe, as well as the Pawtucket, and I'm sure a number of others. And it's great to be here. Thank you.
Thanks, Sophie. Really appreciate your introduction. Harry.
Hello, everyone. I'm Harry Iles-mann. I'm joining you from unceded Gadigal land here, otherwise known as Sydney. Similarly, want to pay my respects to elders past and present and extend that same warm welcome and respect to those of Indigenous and Torres Strait Islander or all cultures that are joining us around the globe today. I've been involved in a number of roles. I do a lot of work in the digital health space. I'm referred to as the health consumer leader. I hold a number of roles advising the Federal Department of Health here in Australia and some other peak health agency bodies. Primarily in the research space, I've been involved in a number of committees for our National Health and Medical Research Council, including some priority working groups around responding to emerging health threats. I've also been involved as a grant reviewer and a contributor to a number of pieces of research myself.
Thanks, Harry. That's fantastic. And so, as you can all see, we've got a wonderfully well-rounded group of people here today to speak directly about publishing and getting research work out there to the community. And because this session is about sharing results and sharing research findings at the end of a project, there's heaps of wonderful sessions already at PxP, and I'd encourage you to catch up with those when you have a moment. We're going to focus specifically on that writing and publishing and disseminating information part of the research work. That's not to say the other stuff is not important. It's really just to set the scene for what you're going to hear and what you're going to engage in today's 50-minute conversation. So we'll keep our session here focused on that publishing and disseminating part, and really, as I say, encourage you to catch up with other sessions if you'd like to learn more about navigating the team environment or some of the other many diverse elements of contributing to research as a patient partner or community partner. So it's my privilege to kick us off today, and I'm going to start with a bit of a step back and think about what are the steps involved in getting research from the data to the academic journal or to the whatever the vehicle is to disseminate it to the community, to the audience you're trying to reach. Harry, I think I'll start with you. Can you give us a breakdown of what are the key steps in bringing the project from collecting the data to getting the work out in an academic journal? That writing, let's start with the writing part.
It's a great question. I should also add as well, sorry, I forgot, I completely forgot the lived experience side of things. I should also say I'm a young person living with complex chronic illness and dynamic disability, and I'm the recipient of 2 liver transplants as well, just so that we've got my lived experience cred out there. Look, I think for me, obviously for different pieces of research, there are different pathways that people can take, and it depends as well in the endpoint of publishing. It depends whether you want to go for a peer-reviewed approach, or whether you want to go through a researching pathway that pops out the other end as more of an opinion piece, whether that's done individually or in collaboration with researchers. For me, though, one of the things that I've seen that comes through incredibly powerfully through a lot of the research that I've reviewed, and some of the back-end work that I've done in establishing some nationwide principles on partnering with patients in research, is the concept of purposefulness and impact, and recognizing and actually starting from a point of origination with your research that matches a genuine or existing community need. I think that's one of the most important things. Quite often the processes can vary, but what we see often in the space is that impact tends to wander or become quite diluted through those processes where it's not very clearly established at the start and maintained throughout. And for that reason, the point of inception of research being partnering actively with patients as partners in the research, and in many cases, I think more appropriately, as actual drivers of that research. We've seen a good example of that in the long COVID community and those suffering from chronic fatigue syndrome. Not a lot of research existed in that space, and the space wasn't particularly willing to take it upon itself to push that along. So the community stepped up and said, it's not appropriate that there's a gap of knowledge in this space. Let's do some work to actually drive through some learning. And that's outputted some incredibly powerful and impactful pieces of research that have then flowed on to impact other areas of chronic illness as well. So I think for me, I'm a little process agnostic, I suppose, recognizing that different people have different abilities, different levels of literacy, different capacity for partnering and contributing. But what's absolutely critical is that point of origination is one that follows through a common thread of establishing a shared value and meeting a real need in the community in whatever it is that we're embarking upon.
Thanks, Harry. I think that's a great place for us to start. And Nidhi, I'd like to invite your comments here, because you've been really at the coalface of setting up groups and identifying needs and areas of need, and speaking with the community to find out what the community needs. So how does your work reflect this idea of impact that Harry's talking about?
I totally agree with what he was just talking about. When it comes to lived experience, what I realize is a gap because science normally looks at just one kind of a condition at a time. That's how specialists are practicing. Whereas as human beings, we exist with multiple issues. Like even if there is one chronic condition, our mental wellness is affected. So we actually looked at that component in the Asia Pacific region for IBD patients. Yeah, so Crohn's and colitis together is also referred to as IBD, or inflammatory bowel disease. And what we realized in the Asia Pacific region was it was not being looked at holistically. So there was a gap, and I think it still is a gap, where you don't have like a psychologist or a counselor working together with your gastroenterologist who's taking care of the IBD symptoms and the treatment plan. So 7 countries came together, the patient organizations in this area. And then we collated some data, did a survey, and then presented a poster during a conference. And this one I'm talking about is like maybe 5 years ago, but I think there is still a lot of work to be done. So totally go with the point that we need to identify what are the gaps that patients are looking for. Then when we bring a study together and then when we publish it, that is meaningful because we want that impact in the lives of people. It's not just for the purpose of publishing something, right? So it's very important to pick one of the points and then see how you're going to bring it across. So we were able to compare, let's say, Australia, which has quite progressed in this region when it comes to IBD care, whereas the other countries are still lacking in certain components and not in the others, that kind of thing. It came out from such a study. So then we can work with the different stakeholders like hospitals where, okay, certain holistic care can be provided through a team approach. Or we could be working with the clinicians to say, hey, can you make it a safe space? Because in our part of the world, many patients are hesitant to even ask questions or to share that they're feeling depressed or share that they're feeling anxious. We don't say these kind of things quickly because there's a lot of stigma still around it. So these are real issues. And when patients are provided that kind of an environment and we are then facilitating that, that is true meaningful work of a patient organization, and advocates bringing that voice across makes it really meaningful. So yeah.
Absolutely, Nidhi. And that I think really underscores why it is so important to have advocates, patient partners involved in getting the information out and published and contributing as an author and as a knowledge disseminator, whether it's creating infographics, writing blogs, writing academic journal articles. So given what we've heard from Harry and from Nidhi, Sophie, I'd like to invite you to comment here. You are at that coalface of editing and receiving the written work. Let's start with the written work. We know that knowledge dissemination can take many different formats. We're going to focus a bit more on the written and the journal side of things. What does it look like when you receive the initial fruits of all of that research labor, and then maybe what's the process to get it to the final finished product that someone might pick up and read on their tablet or whatever device they choose to read in an academic journal, or whether they're choosing to access that information in another way?
Yeah, what really resonates with me, and both Nidhi and Harry said it beautifully, is this gap of knowledge and the lack of holistic view of people and patients. And at the BMJ, when we get research, it's already been done, it's already been conducted. And we need to find ways of ensuring that from proof of concept, patients are involved. And we're not there, we're not at the table, we're not in those conversations. And we have limited scope in what we can do. But one thing we can do is to ask that the research does include patients or the public? And if it does not, to please explain why. So it is one point of influence that we hope, if perhaps they submit something that doesn't have it that time, next time they'll think, okay, this influential journal we're not quite we're requiring a statement, and we're working on kind of ways of not litigating, but ways of making that more formalized. But in the meantime, it's more of an influential role. And so that we do have certain levers, and we try to maximize that as much as possible. And research is better if patients are involved. And that's how you get published. If you have robust research that is answering questions, answering needs of the people who are most impacted. And at the BMJ, and I say we because I am totally believe in this, the mission is to make the world a better place for people and improve healthcare, but also that patient involvement is an ethical imperative. And luckily, those two things work together, that if you do have patients involved, the research is so much stronger and actually helping those who need it.
Thanks, Sophie. You mentioned the statement about how patients or the public were involved in research. And I think even by having what might seem like a relatively simple requirement in place, that's modeling behavior for other journals, for other academics who are reading the work. So I think even something that's relatively small, and as you've all said, we're not there yet, something like that is better. It is, I think, about raising the bar for everyone, and at least it's a bit aspirational, I guess, trying to get people to think a bit more before they start. Harry, I want to come back to you because Sophie mentioned about the journals and specifically the BMJ. I'd like to get a little bit of insight before we get to the two questions that we've got in the Q&A so far. What are some tips that people might take away, or what advice would you offer people when they're thinking about choosing a journal? And again, we'll focus on academic journals here. What sorts of tips and things are there to consider?
Look, I think some really important things to consider from a practical point, in consideration of the audience that you're intending to reach. Things like having journals which are open access, for example. If you're involved in and contributing to research and publishing research, it's going to have a huge impact on a particular community of lived experience. It's going to be really challenging if that sits behind a paywall, for that community to actually realise and engage with and benefit from that. So there's some sort of quite simple qualifiers, like whether or not a journal is going to be something that requires that financial sort of entry threshold, or whether it is actually open access. I think one of the other things is also a question of the support that's available, recognizing that it's not always reasonable to expect, and although we have some very highly driven lived experience representatives, consumer advocates, and patient representatives, it's a really appropriate thing to as well to be considering partnerships and what supporting resources are in place. So having initial conversations with journals or particular points of publishing about, look, this is where I'm at in my research. There's a sort of, a 10% left where I'm really not quite sure how to get this across the line or get it into a format that's going to be the most impactful in this space. Organisations that are amenable to that are open, that acknowledge that value contribution and say, hey, look, that's fantastic. Well, let's sit down and let's work with you and let's give you some support to uplift, the 90% of the bulk of the work that you've done is a really important part of it as well. I think some other really simple things are, from an accessibility point of view, receptiveness to things like, in the instance of just like, let's just take English as a language, but, having plain English, having a journal or working with people who, and I've had it a lot with researchers that write in research language, and sometimes even other researchers don't understand what's being said in research speak. So working with partners or working with publishing partners or research partners that are able to help you. Sometimes you're able to help them translate content into something that's actually going to be more accessible to the public and therefore more impactful and easier to translate. But also, actually quite importantly, that there are certain ways of doing things in the research space and in the publishing space, and working or partnering with researchers that understand that language and are able to help you translate elements of what you've produced into a format that's compatible with what those publishers are seeking. So I think what it's really about is finding a balance. Like as with most things in the representation and advocacy space, it's all about balance. It shouldn't be one domineering over the other. But I think ultimately it's keeping in mind, in my mind, one of the key what I suppose the two key components are, your self-integrity and safety and support. You don't want what you're doing to come at the cost of your own personal health, well-being, or reputation. And secondarily to that, if what you want to do is achieve impact, it's being mindful of, through that platform, with the mechanisms that they work under or their avenues of dissemination and translation, what barriers or enablers do they as an organization actually create that allows me to translate what I've done into an impactful outcome for that community that I'm trying to help support.
Sophie, I'm going to invite you to build on some of these comments. How do you work with authors at the BMJ, or broadly, how do you see the BMJ working with researchers and authors?
Well, just in case I don't mention it later, there's the research that the BMJ is known for, but there are other sections that we invite patients to co-author, or authors, such as opinion section or analysis. So even if you're not involved in a research study per se, it's bringing your lived experience to the table and showing kind of the humanity. It's always important to remember that they're numbers, there's data, there's stats, but they're people at the end of this. So there are other ways of bringing your voice into the fold.
I love that humanity, Sophie. That's beautiful.
Yeah.
Nidhi, one of the questions that has come up in the chat is about how organisations can support patient partners in organising, coordinating and publishing their own study or their own research. Can I get you to speak to that? And it may not be that your organisation itself is supporting individual researchers, but this general idea of what patient organisations can and can't do, and what you see your role being in disseminating information.
Yeah, it's a very good question. And it just brings me, or it reminds me of the first time when I was approached that, can you publish on how to set up a support group, a patient support group? And I'm like, I don't have the time to do it. Okay, I don't have the time to write. That was my response. And I was pleasantly surprised when this company, which is actually a contract research organization, and they said, we'll get you a writer. I was like blown away. I'm like, what better can someone get for this kind of a situation? Because I know how to do what I do, but I wasn't sure how I could be writing a research paper. That was my big doubt. And by the way, I do have 2 master's degrees, and I also have a graduate certificate in counseling. So I have a lot of that kind of training, but to do a research paper, I didn't feel confident. So I was very fortunate that they could get me a writer, and there was an interview, and all that I wanted to say, I just conveyed it to this person, and she did the writing. And then together with our collaborators from the CRO, a paper was put together. Then comes the data, there comes the other part, which makes it truly a scientific article. So the whole thing got published, and that is where the sponsorship also came in, because this was under Dove Press, and I think that journal actually charges. So I didn't have to go and look for all these things. I'm just very fortunate that people came forward to say, let's do a paper together. So there was the sponsorship, there was the writing component, the submission. All that I had to do was share the experience of how it's done and how someone else can replicate what I have done. And then I just had to edit, go through and make sure I understand what I'm reading because my name as the first author is going out. So clearly I should know what's going out. So that was my first experience. And subsequently answering the point about partnering with researchers, again, it was a researcher who came forward to say, let's do a paper on a landscape review of IBD in Singapore. And I'm like, sounds like a fantastic idea, because that idea didn't come in my mind. Yeah, we as advocates sometimes talk about these things, but we don't know how to label it. That under which category a certain thought can be classified and you can publish. That was my challenge. So I was like, wow, I like this idea. Okay, let's sit down and discuss. So we discussed, and then it wasn't just the researcher from a very reputable institute called A-STAR in Singapore. He also collaborated with another scientist in Japan. So that's how we then wrote the next paper. And that's an open access paper. And it is quite a prestigious journal called Intestinal Research. So this is just 2 years ago, and that got published. So I think looking for collaborators, looking for writers, these things as a patient, starting from, that space as a patient, we would not know about. But I was very pleasantly surprised that people came forward to say, let's do it together. And just having that open mind, I think, was important for me. That having the will and the open mind to listen and say, okay, what is it that you want from me? What is it that you have? And how are we going to make it happen? That, I think, is very important. Yeah. Thank you.
Congratulations on the publications, Nidhi, and you make great points about the collaborating side of things. And this is very much a reciprocal relationship, that all of these parties are bringing something to the table, and together it's greater than the whole is greater than the sum of its parts. Sophie, please go ahead.
Yeah, Nidhi, you just made me think, and that's just such a best practice example you just shared. I was just so thrilled to hear that. And I do think that patients, and I find this a challenge I have when kind of encouraging people to write, will say, well, I don't have the technical expertise. I don't have the skills. I don't have 100 degrees. And your expertise is your life. And you may have a specific condition, but you probably have things that are universally applicable. You maybe specifically to others with your condition, but also universal kind of application to being a patient. And you can also just act as a sense check to the collaborators, and kind of you might not feel comfortable writing everything, but just to be that sense check, and to be that kind of sounding board for the others can be incredibly valuable. Well, and just to keep people kind of on the mission, on the cause of why they're actually doing this work. So even if you don't have as formal a role, it can still be incredibly valuable. And just another thing, open access, and that's something that's definitely a work in progress. I know I saw a lot of comments in the chat about open access, and I think that's definitely the model that we're trying to get to be as inclusive as possible. So I love seeing all the kind of advocacy for that. Thank you.
Thanks, Sophie. And a word on open access, if I may. There are many different ways of publishing open access. So I think we traditionally think of going to the journal and you have to pay often a really big fee to get your paper published without the paywall that Harry was mentioning earlier. There are other places. You've probably heard of preprint servers. medRxiv is a really famous one. It got famous during COVID. Those sorts of places will provide an open access link where you can put your work online. It's got a record to say that it's yours. It always belongs to you. It's public. Anyone can see it, and you don't have to pay. There are other ways of publishing open access without having to find the upfront cost. The other point to make about open access publishing is in the US from 2025, and in Australia, I believe, and already in the EU, there's been a big push towards all publicly funded research must be made available in open access form. So recognizing that the taxpayer is funding a lot of this work, and then everything's behind a paywall. So I agree with you, Sophie. The landscape is changing quickly, and we're going to see a much different way of accessing. We already are seeing a much different way of people accessing information, which is good for everyone across the world who needs to have access to this work. Harry, go for it.
Yeah, I just wanted to add really quickly to that. I think there's also one really important thing that needs to be added onto the open access piece, and that is simple access. There's no point making all of these resources open access if we continue and we sustain the level of, I mean, obviously in the legal space, we say legalese and, clean speak and all that kind of stuff, but that just really high bar of literacy for entry and understanding. So one of I think the second challenge that we're actually going to have once we do pull down some of those walls to access is to actually figure out how we establish readability and access as a viewability principle and a knowledge translation principle as well. So that's getting a few steps ahead, and that's no mean feat to accomplish that. But one of the things that I think that's really important, and to sort of circle back around to the point earlier, is that's the importance, and I think the value of those patient partnerships early in research is that you're actually co-producing research that is itself fundamentally built around and driven by the language choices and, often simple communication that is embedded by the people with lived experience in the research, so that the outcome is just not this absolute block of text that you've got to hit your head against 50 times to figure out just, half of what it's saying.
For sure, Harry. Great points. Sophie, do you want to add to those?
Yeah, Harry, I was just going to say what you just said at the end. Is that that's why you need patience from the beginning to make sure it is, and to make sure it's not just abstract concepts that are just being bandied about in the kind of ether, that there actually can be concrete outcomes that come from the research. And something else that people can do as a patient is to be a patient reviewer of manuscripts. And that's another way of making sure that things are easy to consume and user-friendly and make sense and can have a better chance of being put into practice and being used in the clinic. And that's something that, just to put a plug for BMJ, we're always looking for patient reviewers. And if you do review articles, you do get a year of BMJ free, but all our research is open access. Speaking of open access, but there are other, as I said, other sections that you get access to. So being a patient reviewer for any journal is a really, really effective way of ensuring that what is being put out there actually has feasibility and will impact those, again, most affected by what's being said. Thank you.
Sophie, just sticking with you, and Nidhi, I see you've got a hand up. I'll come to you in a moment. Sophie, can you give us the 2-minute summary of what it is to do the patient reviewer job, what that involves, how do people think about that?
So specifically being a patient reviewer?
Yeah, what's involved in that job?
I'll talk about the BMJ. So the BMJ also has 60 plus sub or specialty journals, and they're all desperate for patient reviewers because that's part of embedded in everything the BMJ and BMJ family does, is making sure things are relevant to patients. And we have I can share a link. There's a way of signing up, and you can either say you can be a patient, you can be a caregiver, just a member of the public. And you can say, I want to focus on this condition, or I'm happy to look at any type of research, general research, I'm happy to look at anything. And then there's training. It can be, I know whenever I'm trying to recruit people, they say, oh, I don't have the expertise. I don't have the technical. I say, you live with the condition. You have a loved one with the condition. You have it in spades. And just, again, what we've been talking about for the past 40 minutes is making sure that the gaps are being addressed. And that's as a reviewer. And yeah, it does. I mean, it is labor. So there's a lot to consider, but I'm happy to speak separately offline with anybody who would be interested, because it's a great way of making sure that the research being published is relevant.
And for most reviewers, whether it's grants or academic articles, you read the manuscript or you read the application, and then you write your comments about what you think about it, whether it makes sense, and a summary of your critique of the work.
Yes, sorry, I should have mentioned that. And you don't, there may be things you don't understand, and that's actually very valuable, because it should be, it's actually can be a benefit to not have all the technical expertise and the stats and everything, and just to make sure it is resonating. So thank you, Claire, for putting those specifics in.
Nidhi, you've been waiting very patiently. Please go ahead.
Yeah, I was just adding on to the suggestion from Harry about accessibility, keeping it simple. So I was drawing a parallel with many websites, which would have just a button on top that says translate. Yeah, that is a feature which I think technology can help us. AI can help us, I think. And similarly, it could be a lay language summary of the paper, which could be a one-pager out of those 11 pages, let's say the whole article is about, or the publication could be longer. But a simple summary would be very helpful for someone who just wants to get to know. And I think I saw a comment, someone said, oh, AI can help us with that, So having a simple button there, I think would be very helpful. I'm putting it out for journals to consider. And that would be a very useful feature, because I try to do that by myself. But then it just means I need to copy the article, put it onto ChatGPT or something else, and then get it translated for me. Yeah, so that is absolutely essential for someone who's newly diagnosed, looking for research in that field. So those kind of things, I think, really makes a difference in the life of a patient. So we need to find those tools to make it easier and easier. Yeah. So having reviewers on the, like, say, BMJ journal has done that. The other point I quickly wanted to bring in was we don't need to do a full-fledged research paper. We could also do poster presentations at different places. That's another platform. So because we're talking about BMJ, I was at their conference in Melbourne last year, and we had done a poster presentation. So that is something I felt was simpler to handle and easier, quicker to do. Another one we had done in Taipei. This was again on the Asia Pacific IBD Alliance. The findings of that can be a simple report and then presented as a poster during a conference. So that's another way of bringing the message across.
Yeah, thanks, Nidhi. And thanks for getting us to that place of beyond the traditional academic article that, as you mentioned, Harry, can sometimes feel like banging your head against a brick wall to try to make sense of it. Nidhi, sticking with you, I'm going to allude to Ray's comment here, or question is around implementing published work as someone with lived experience. You've touched on some of these, and I just want to give you the opportunity to expand a little bit more. The topic that Ray's considering is ensuring that people are supported and safe. So thinking about your experience in getting the poster presentations together, what have you learned about what you need to ask for and the sorts of supports that you need to bring that work to fruition?
Okay, when it comes to work to fruition, I think there's still a lot of work to be done, because the more I review all that we have published, and then what is the impact of it in the lives of patients, I think there's a big gap there. Okay. We can publish what we publish. We can be saying that there are these gaps, but then unless and until you bring it to the policymakers, to the regulators, to the scientists or the researchers who are looking into developing a new drug, coming up with better outcomes for patients, I think there's a big gap. It's good to collate and bring the pain points across, but for it to actually come to fruition, to see a change in the quality of life of a patient, I think it takes a long time. And so we can only substantiate what we are saying as advocates by using such published data, by publishing papers or posters or reports, whichever form we do this, but it just validates our work. Otherwise, what's happening in patient organizations is you have a support group and a lot of people are sharing their lived experiences. And after that meeting, it just drops there. It stops right there in that room. Nobody is doing anything beyond that. What that space does is providing peer support, which is very meaningful. So that is good. I'm not undermining that importance. It is important. The patients need that support. The family members need that support. But then to make some kind of a change in the patient's journey going forward, we need such publications. So it validates every statement that is being shared in that support group. But after that, what happens is only if you fit into the country's regulatory system or in the policies of the country, only then some change can happen. If not, you still need to go back and conduct a survey or some kind of between patients, between clinicians, you still need to bring in more data, more lived experience regarding, let's say, a new drug that is being introduced into the country to manage that condition. So then very specific kind of information is needed by the regulators, by the country's policymakers, yeah? So I think there is a space for research publication, but then to see the final outcome, I think there's still a lot more work to be done.
Thanks,
I hope
Nidhi.
I
Harry,
answered the question.
you did a great job. Harry.
Yeah, I just wanted to quickly jump in just on that notion of safety in partnering with patients in research as well. I think what's really important to recognise is that, and hopefully, Sophie, you'll appreciate this. It's not the sole responsibility of the end publisher to be ensuring safety in this process. If we're only doing safety in partnerships at the end, we haven't done it properly. What's really important in those practicing partnerships with patients and consumer representatives in research is that safety is actually embedded into the practice. So a really good example that comes to mind for me of that is here in Australia, our national peak of medical research has a statement on consumer and community partnerships and participation in health and medical research. We have two main research funders nationally. We have the MREA and the Medical Research Future Fund. Now, as part of the MREA, there's actually a weighted component of that grant assessment that is specifically addressing consumer and community involvement in research. And having sat as a grant reviewer for the Medical Research Future Fund for a round of targeted call for research, talking specifically to vulnerable populations, particularly childhood mental ill health. One of the things that I looked for as a reviewer were that people making applications adequately provisioned support persons in roles in that research project to ensure that there was adequate psychological, emotional, social, and wellbeing safety being practiced to support not just the contributors and patient partners in research, but also the participants in that research as well. If we're leaving the question of how do we support safe publishing partnerships until the very end, it's likely that people have already been traumatized by the process before they've reached that point. So it's really critical, again, to go back to the beginning and ensure that the process itself is actually a safe one. Because I also do think it's, it's a bit unrealistic. It's also not fair on the publishing end of on the pointy end of that workload that publishers and journals and other partners in disseminating and translating information need to bear the sole burden of compounded trauma that's come about as a result of that research partnership.
Thanks, Harry. I'm really glad that you make the points about psychological safety, and it builds on Alex's question in the Q&A. So I'll paraphrase Alex's question, and then I'll invite Sophie and Nidhi to respond as well. And of course, you're welcome to do so too, Harry. So Alex is sharing that they've struggled a lot with brain fog and being able to write with brain fog and executive dysfunction. What are some strategies and I invite people to comment in the chat here as well, because I'm sure that our broad community who's online will have some ideas here too. What are some of the things that people might put in place, research teams might put in place to support folks when they are struggling with, particularly with cognitive difficulties and that very cognitive task of writing. So Sophie, maybe do you want to kick us off here?
Yeah, sure. Great question, Alex. And I, as someone, stroke survivor and someone with long COVID, I completely know what it's like to have brain fog, and everything takes so much more time than I would like. Can I speak from a non-research point of view?
Please.
Because there are other ways of moving the needle, or more than moving the needle in healthcare, and there are other ways of getting your experience out there and having it change policy and clinical guidelines and all of that. And it's not just it's not just in the domain of research. And whether it's writing at the BMJ, and we have something called like What Your Patient Is Thinking series, where you talk about an experience, either good or bad, you've had with the healthcare system, and things that clinicians can learn from this story that they can apply the next day. Very kind of concrete things that they can do, be it about communication or respect, all of those things. And that, there's no kind of time pressure on that. And as publishers, even if you don't have brain fog, we understand the burden of being a patient or a carer, and there's a lot of things going on. So there's more than one way of influencing the landscape and the dynamic. So I don't want to speak from being part of a research team, because I haven't done that in years, but I know there are other ways, and there's podcasts. There are other ways of publishing. There are, non-medical journals. So there's lots and lots of different avenues. And if, self-directed, without kind of having this other team that's relying on you. So there are many different avenues. If you feel like you have something to say, that there's a place for that. Thank you.
Thanks, Sophie. And I can see we're getting some suggestions through in the chat too. Nidhi, please go ahead.
Yeah, I was just thinking about what I've already shared, that there was a writer who helped me, because that was 2017. And by then I was diagnosed with 5 conditions, okay, not just one. So every condition brings its implications, and then with medication, there are side effects. So it all just compounds, and thinking clearly becomes quite difficult, no doubt about it. But we know that there are different times of the day. If we are aware enough of how our body is responding to these conditions, there might be pockets of time where we are a little bit functional, better than the other times of the day. So I would jot down certain points at that time. Plus, there are strategies to help manage our brain fog also, which is outside of what we are discussing. It could be simple exercises, simple meditation. These strategies help us. And I've also heard from different people where we talk about being awake in the middle of the night. It could be 3 a.m. We are wide awake. And that is, in the normal scheme of things, we would think, oh, we need to sleep. We are forcing ourselves to sleep. But actually, we could be pretty productive at that time. So use it. If you're alert at 3 a.m., that's the time you'd write what you want to write. I did that, okay? And that is where I'm sharing that I would be excited that I would put aside certain books and journals and coloring or whatever I like doing, because I know I will be awake in the middle of the night. So instead of fighting that being awake state, rather have something that you love doing. So if you are really wanting to publish something, have that strategy, put that paper and pen in one corner, that in case you wake up and you feel alert at a time, you can jot it down. Or people use things like Siri, can you record what I'm saying, kind of thing. These are the 5 points I would like to jot down at this time. And then you can go back to sleep. So a simple little thing. Sorry, I'm just sharing by my personal examples.
That's wonderful, Nidhi. That's exactly what I was hoping you would do. So thank you very much for sharing. And I can see there's more people sharing their personal experiences in the chat too. Harry, please go ahead.
Yeah, I think I'm making the same point about a different topic of discussion, but is also just being mindful that I think it's fair for us to say that the expectation isn't that we deal with this entirely and solely by ourselves. I think there's a reasonable expectation of institutions and organisations if the space and the sector wants people like us to contribute the enormous value that we do. It can't be through a structure that is 100% their way or the highway. So as much as I agree and support, there are a lot of things that we can do as individuals in dynamically in our own lives to manage, the way that we actually manage our time. As someone, I refer to myself as a spoonie with my chronic illnesses, and I've run out of spoons throughout the day. But sometimes, it's also just not reasonable to expect that one individual, particularly the person that is carrying, in this instance, both sometimes the privilege and the burden of those lived experiences, to solely shoulder that responsibility of having to manage that time and figure out how they contribute. I think there's a really reasonable argument to be made that there's a fair expectation that if organisations that we engage with, or that want to be there to support, and I think importantly, benefit from the contributions that we make, then it's not unreasonable for us to ask for a little bit of flexibility and dynamicism in the approach and arrangements that we take about approaching research.
Harry, while you've got the mic, I want to take a moment to get to Carrie's question from the Q&A before our time's up here. And it links to what you were just talking about flexibility and about resources. And Carrie's asking about the role of consumer organisations. And Nidhi, I'll put your name next to this one as well, in supporting people with lived experience to get their work out there. And that finding resources is really challenging. So have you got some quick strategies or thoughts here, Harry, that you would share in a minute or so?
Yeah, absolutely. And also shout out to Carrie, hometown, Health Consumers New South Wales. Obviously a huge fan and a working partner of mine. Look, again, I think this is where it's really important that we're talking about research at a higher level. Particularly, and again, I'll use the example of the National Health and Medical Research Council in Australia. It's not reasonable to expect that every state, territory, or jurisdictional consumer representative peak body develops their own bespoke set of guidelines independent from one another. So the NHMRC, in partnership with Consumers Health Forum of Australia, which is Australia's peak consumer representative organisation, took the initiative to develop a nationwide document that outlines, a guide on partnering effectively with patients and health consumers in research. So I think there's a really important role to be playing, that one of the ways that we actually avoid the excessive costs that come with these things is recognising that we don't have to keep re-prosecuting these documents and resources. What we should be doing is getting together as a collective, pooling funding, in this case funding from Commonwealth government, and actually collaboratively developing documents that provide the rough bones or a guideline for people to then quite easily add or build on their own content, but which they don't have to re-prosecute and reproduce from the start every single time someone wants to enter the space. So I think there is also a bit of a sort of a harmonisation and standards piece around it as well, but acknowledging that it is particularly difficult, and a lot of these organisations are funded at a jurisdictional level. Money and people's time only goes so far. So one of the other important things as well is that we as a community of lived experience are, I hate to enter the political sphere, but that we do leverage our power as a voting public, and as people that can drive agendas and interests on, at a national platform, and actually collaborate together to say, hey, we need more funding or resourcing. This is a gap in our space. There are people that are missing out or that are not benefiting from research that really needs to be done. What are some ways that we can look at actually, pulling some funding or resourcing mechanisms, or building communities of practice to start addressing these issues in a consistent, harmonised, repeatable and scalable way?
Thanks, Harry. We're right up against the clock. Nidhi, I'm going to give the last word to you very quickly on one or two strategies, and then it's back to Janelle.
Sure, yeah. So talking about how patient organizations could bring their voice across, one cheap way, an easy way, is podcast. I've done one such podcast. It's called Life Takes Guts with Nidhi Swarup. And the reason was to reach out to people who are bedbound, who could be newly diagnosed, they could still be in the hospital and can't reach even a support group. So bringing your voice across brings hope, brings some comfort, because not every illness is common. There are many rare conditions out there. So patients need to hear, and we needed resources with an Asian face. We didn't have that in our part of the world. So that is one way of bringing your message across, that these are the pain points, these are the successes, these are the strategies that patients use to manage their lives. But as a collective, that is the podcast of our charity called Crohn's and Colitis Society. Okay, that doesn't cost too much. The other part is setting up the Alliance of Patients Organizations is exactly that. We bring the different stakeholders together. Our board has researchers, hospitals, patient groups, just about everyone in the healthcare space is together so that we can co-create solutions going forward. So I think I will pause here because I think we're running out of time. Happy
That's
to take
brilliant.
questions on the side. Yeah, thank
Brilliant work, Nidhi. Thank you. And thanks to Harry and to Sophie for a wonderful panel session. Janelle, I'll hand the mic back to you.
Claire, I'd really love to thank Claire and all the speakers for your fantastic work and insights today. I've taken away lots of, I've tweeted a few, but lots to unpack in there. We're now going to take a 30-minute break. Come back on this link at that time for session 2. I look forward to seeing everybody then. Thank you.
Thank you.